Please start.
Hello, everyone, and welcome to today's edition of Beyond Sugar, where we bring you valuable health information to help you live your best lives. I'm Dr. Gagan, and we have a very important topic to discuss today: hyperkalemia. This condition, which involves high levels of potassium in blood, can have significant effects on your health if not managed properly. We are honored to have with us today Dr. Ranjan Isaac, a renowned nephrologist, MD/DM, and who will be guiding us through understanding hyperkalemia, why it is crucial to diagnose it timely, and what medical advice you should follow. Dr. Isaac has extensive experience in the kidney health and will help us simplify this complex topic. So, whether you're here to learn more about managing your health or want to understand how you support loved ones, you are in the right place. Let's dive into the discussion and empower ourselves with the knowledge. Welcome to this program, Dr. Isaac. We are privileged to have you with us today. And to start and kickstart the program, I think it would be nice to understand the disease itself first. I request you to help our audience understand, what is hyperkalemia, why it is important for the general public to be aware of it, and later on you can also explain how it affects the body and what symptoms patients should watch for. Over to you,
Thank
sir.
you, Gagan. Thank you for the wonderful introduction. Uh, I will be speaking in Hindi as well as English so that everybody can understand. Hyperkalemia is a situation that we commonly face, particularly in patients who have kidney disease. Now, let me tell you what is potassium. Potassium is basically a very important electrolyte of our body. It is involved with a lot of important functions within the body, which include maintaining the cell integrity, the electrical conduction system within the cells. The heart has got an electrical circuit, so it maintains the integrity of the cardiac electrical circuit. Similarly, the muscles have also got electrical activity because of which they are able to contract and relax. Now, all this is governed by potassium. At the same time, potassium also affects the blood pressure of an individual and is very important for maintaining the calcium metabolism of the body. That means it maintains the bone integrity also. So it is a very important factor or electrolyte of the body. Now, there is a basic intake of potassium in the body, and there is basically it is excreted from the body so that the body levels of potassium remain constant. Now, the normal potassium level within our blood is approximately 3.5 to 5 milliequivalents per liter. Anything which is more than 5 milliequivalents per liter is called as hyperkalemia. Now, hyperkalemia we can grade as mild, where the potassium is between 5 to 5.5 or up to 6. Then moderate, where it is between 6 to 7, and severe when it is more than 7 milliequivalents per liter. Now, when the potassium levels go beyond 6, the danger begins. And it can be so dangerous that an individual who is talking to you and is sitting in front of you and talking can suddenly collapse and die. So, it is one of the most serious emergencies that we face in our day to day practice. Does that answer your question? Okay, I'll go beyond this also. Now, what are the conditions where the potassium levels can go up? Now, the potassium levels can go up particularly if the kidney is diseased. Now, kidney is the major organ from where the potassium is excreted in the urine. So, if the kidney is diseased, the potassium accumulates in the body. So, in situations where the kidneys are weak, these are the individuals who are at a risk of developing high potassium or hyperkalemia. Then there are certain drugs which are commonly used in day-to-day practice, particularly drugs which are ACE inhibitors or ARBs, like telmisartan, losartan, ramipil. So all these commonly used antihypertensive drugs can also cause an increase in the potassium levels. Then over-the-counter painkillers like ibugesic or diclofenac. So I'm not taking the trade name. So these commonly used drugs can also cause an increase in the potassium levels. Then drugs like anticoagulants like heparin, they can also cause an increase in the potassium levels. So all these things will occur in a scenario where the kidneys are weak. So when we are using these drugs in a scenario where the kidneys are weak, these are the individuals who are susceptible to develop hyperkalemia.
Okay.
Then there are certain other conditions where you can have high potassium levels. Say there is a person has severe blood sugar levels or very high blood sugar levels and go into ketoacidosis. So the potassium shifts from within the cells into the circulation. So this is called shift. Then there are certain situations like there is severe diarrhea and dehydration. So the potassium can go up in that also. Then there are other situations like the adrenal glands are not working properly, Addison's disease, or patients who have diabetes and land up with type 4 renal tubular acidosis. Then crush injuries. So these are the situations where the potassium can shift into the blood and result in severe hyperkalemia. So you can have high potassium in a scenario where the kidneys are diseased, or high potassium in scenarios where the kidneys are not diseased. So the question is, what happens when the potassium levels go up? Now, as I have told you, that when the potassium is basically involved in the electrical activity of the muscles. Now, heart is also a muscle. We have the routine muscles that we have there. We have the intestines, which also contain muscles, and we have the blood vessels, which also contain muscles. So, if the potassium level goes up, the muscles get paralyzed. It's as simple as that. So, in an acute situation, sudden paralysis means you can have weakness. You will not be able to move your limbs, and the heart starts slowing down. It can slow down to such an extent that it can stop. So, if an individual is talking to you, suddenly he will collapse. So, this is very, very important to understand the potassium, particularly in patients with renal failure. Then, long term potassium, high potassium can interfere with the guideline directed management of diseases, where we need to give drugs which cause a rise in potassium. So, the potassium levels have to be balanced in such a way that we can maximize the drugs. Long-term hyperkalemia can also result in weakening of the bones. It can also result in nausea, vomiting. So there are a lot of symptoms that can happen with high potassium. So it is very important to determine that potassium is high and how to go about it.
Sure. Thank you so much, Dr. Ranjan. I think very, very useful information. You have spoken about, the disease, hyperkalemia, and then how it represents, what are the symptoms, muscle weakness, as we all heard. It can affect heart, and very high levels can lead to cardiac arrest. So it's scary. So it's important to, identify the condition. And these patients, as you said, can also present with normal symptoms like nausea, vomiting, and you have also beautifully classified it into different categories: mild, moderate, severe, and the conditions where it is usually associated with, or certain disease conditions where the risk is very high, like CKD, kidney disease, diabetes, Addison's disease. So thank you for that. Since we have touched about the disease, I think it's the right time we talk about, and if you can walk us through. We understand it's important to identify it. How can this condition be diagnosed, and what is the importance of monitoring or checking regularly for the risk of hyperkalemia in these patients, especially who are at high risk?
Yes, Gagan, it is very important. As I said, hyperkalemia is an emergency. It can kill an individual, and everything depends on how fast the potassium is developing within the body. Now, most important way of determining the potassium levels is to monitor the potassium levels or check the blood potassium levels. But What happens is that when you are taking the sample, it takes around 2 hours for the potassium report to come. So it is much more easier to do a simple ECG to see whether the potassium is affecting the cardiac muscle or not, because that is the prime point where an individual's life is at risk. So there are certain ECG changes which are known to all the physicians, like you have a tall T wave, the P wave disappears, the QRS complex widens. So, and then ultimately you get a sine wave configuration. So ECG is the first and foremost investigations which will tell you whether a person is having hyperkalemia or not. Second thing is you check the potassium levels of an individual. So anybody who comes to you with weakness of the body or weakness in the limbs or has unexplained symptoms, gastrointestinal symptoms, you check the potassium levels. And so basically it is having a high index of suspicion. It is very important to take a detailed history whether the person is having a kidney disease or not. If there is a scenario of kidney disease, a chart audit or review of all the medicines that he is taking is very important, because there are medicines which will cause an increase in the potassium levels. So being aware of the fact that hyperkalemia can develop, and it is very an ECG being done at the earliest and the drug being monitored. What we do for our patients with chronic renal failure is that we monitor the potassium level at least once a month. And those people who have a tendency, particularly those who are on drugs where there is a risk of developing hyperkalemia, we try to do once every 2 weeks. Then again, depending on the severity of renal failure, if the renal failure is not that severe, we can delay the matters for 2 3 months, or where the renal failure is more severe, there we do it more frequently.
Great. Thank you so much, Dr. Ranjan. I think you have aptly emphasized on the need to diagnosis. And as you see a lot of CKD patients, so it becomes important to regularly monitor and keep a check on their potassium levels. And a very important point again emphasized, which stayed with me, is that instead of waiting for the reports, if you have are highly suspicious of having hyperkalemia, it's good to go for ECG. Done immediately to prevent any damage to the heart muscles. Thank you for that, sir. Now let's move on to the treatment and management. Now, what are the currently, the standard treatment options for managing hyperkalemia? And after the treatment, also, if you can touch upon any lifestyle modification you would advise to these patients who are at risk or have already developed,
Gagan,
hyperkalemia.
you have touched a very important point. The point is preventing hyperkalemia. That is the first and foremost thing that you have to do. So, first is, if you know that you are having a condition which will produce, you are at risk of hyperkalemia. Second, you should be aware that of the drugs that you are taking and what are the side effects of those drugs and how they can affect the potassium levels. So these are the particular people we target, and education is the most important aspect in this. So we specifically tell them to avoid certain foods, namely, they should avoid fruits, they should avoid juices, they should avoid pickles. Then there is murabbas are used in north a lot, so that has to be avoided. Then drinks like nariyal pani, coconut water, jaggery, which is commonly used in place of sugar, dry fruits. So these are the four, five, six things which have to be avoided. Then, depending on the severity of renal failure, we also tell them to cook our vegetables in a specific manner. What we usually recommend is that you chop the vegetables and boil them, peel first, chop them, and boil them for at least 10 minutes, and then drain out all the water, dry the vegetables, and then cook to taste. And whatever water is drained out should not be reused for cooking. So, these six preventive things one has to be careful. Then The lot of times, in spite of all these things, people are not compliant, and then that is the time when they land up with hyperkalemia and come to you in the emergency situation. So the first thing that we do is to stabilize the heart. So we use injection calcium gluconate, basically to improve the rhythm of the cardiac rhythm and rush the patient immediately to the ICU, intensive care unit. Then there are certain drugs that you can use, like beta agonists. You can use for nebulization. You can use sodium bicarbonate, and you can use insulin, you can use dextrose to shift the potassium. Now, what with all these things, what we are actually doing is we are shifting the potassium from the extracellular space into the intracellular space, but we are not removing the total body potassium. So if we lapse, the potassium will come back again. So you have to remove the total body potassium. So for that we use sodium polystyrene uh, repeatedly and lower the levels of the total body potassium. Then we identify why did this hyperkalemia develop and address the reasons for that. And in severe situation, a person has to be taken up for emergency dialysis to remove the potassium. So this is how we manage the potassium. But what I want to emphasize is that we should not get into this situation. We need to prevent it, and we need to be compliant with the doctor's directions, particularly when we are eating the type of food that we are consuming. So that is where the key to preventing hyperkalemia is.
Great. Thank you so much, sir. I think you have nicely emphasized on the need of prevention is the key here, and lifestyle modification. How by making very conscious choices of avoiding certain fruits, juices, coconut water, murabbas, and cooking in a particular way can be really game changing for these patients at risk. And you can protect yourself from having this condition. And then you have also talked about if one has had a hyperkalemia episode, how to manage it with the medication. I just have a curiosity question, and for the better understanding of the audience. So you mentioned about the cooking mechanism where water needs to be drained, and that water, the vegetables, when once boiled, that water needs to be drained. How and then it has to be not reused for cooking. How will this help? Just
Basically, what is happening is when you're boiling the water, the potassium shifts into the water. It is a matter of osmosis. From a high concentration area, it goes into a low concentration area. So the potassium leaches out from the vegetables, and simple things like potato is also very high, has a very high potassium content. All the green leafy vegetables have very high potassium content. So it's not that you can stop eating these vegetables and you stop eating all the food. So it is important to remove the potassium from these vegetables, and then cook to your taste. Because see, most of us, all of us, have lived a very good life. We have had the best of food possible, and if all of a sudden you put restrictions on the patient, it is a very depressing matter for the patients, and half the people become psychotic, and the only thing they talk about is food. So it is important that you have to be liberal with the food for all of them, and at the same time avoid getting potassium. Now, there are certain drugs which have been used mostly in the West, and they are not available in India, like patrovir and zincronate. So these drugs are being used orally for people along with the thing, so that the potassium levels remain low. But in our Indian scenario, it's not practical. So what we do is, this is just an innovation, is that we can put our patients on regular sodium polystyrene, 2 sachets a day or 3 sachets a day. This can prevent development of hyperkalemia, but there are no randomized controlled trials. So this is something that I do as a last resort, because if a person or an individual is not compliant and is repeatedly coming to you with hyperkalemia, and you know you may lose the patient because of hyperkalemia, this is what we do. To a very great extent, we have been successful in preventing hyperkalemia. And at the same time, particularly in patients who are at high risk of hyperkalemia, those are who on drugs like ACE inhibitors, ARBs, mineralocorticoid receptor antagonists. So these are the people where we have to, balance between giving the maximum dose of a drug and at the same time preventing hyperkalemia. So these are situations where you can use it.
Sure, sir. Thank you again. I see one, message from maybe a patient for you, sir, and this patient has undergone, PUV surgery in 1998 and then BNI surgery in 2013. CKD stage 4, creatinine levels 3.25, polycythemia 2, hemoglobin 18.5, potassium is looks okay 4.3, no urine protein. Probably he just wants, he might be a little concerned since he's a stage 4
Stage
patient.
4 is the
Would you
time
like to?
where one is at a risk of developing hyperkalemia. So, as I have stated before, you need to control your diet, particularly, you need to be aware of what are the foods that are rich in potassium, avoid those. I have stated the six commonly used foods which have very high in potassium content. Then prepare your vegetables in a specific manner. Avoid juices, etc., and just follow the instructions of your doctor. I'm sure you must be under care of a nephrologist, and they would be taking care of your diet and rest of the parameters. So I don't think there is anything to worry. Just follow the orders of your doctor as he guides you.
Great. Thanks, Dr. Ranjan. I just, again, for the interest of the audience, and just emphasizing on the fact you have already stated around the management and also emergency conditions. But when should someone consider hyperkalemia a medical emergency? Uh, and what steps should they take in
Whenever
such a
the
situation?
potassium is more than 6, it is an emergency. Between 5.5 and
Okay.
6, it is an urgency, not an emergency. But it does not mean you ignore this potassium. You need to see why you are having higher levels, whether it is drugs or your diet or anything. If you take the precautionary measures at that time, you will not land up in problems. But the problem comes is that most of the patients are not aware that these things can lead to serious issues. So, patient education is a very important cornerstone in managing hyperkalemia. We need to explain to our patients. So, the role of dietitian is paramount in whenever we are managing the patients with kidney disease. So that is the thing. And for the physicians, is that you need to understand that even if there is no renal failure, if there is a crush injury, or the patient is having intravascular hemolysis, or the patient is in diabetic ketoacidosis, or the patient is having problems with the adrenals, hyperkalemia may occur in spite of the fact that their kidney functions are normal. Diabetics also with a mild renal failure may have type 4 renal tubular acidosis, which can result in hyperkalemia. So the physicians have to be aware of the various circumstances where potassium levels can be high in spite of normal kidney functions. So that is what I am trying to say, that patient education is more important, and the doctor's participation is also, awareness is also equally important.
Yeah, and so I think that's one of the reasons we chose this topic. We somehow feel that hyperkalemia is not much talked about or in by the general public, I would say. So the awareness amongst the public probably is limited when it comes to hyperkalemia. And thanks.
It is very important because we have had patients who landed up in cardiology and with a pacemaker, whereas it could have been simply managed with drugs. So it is very very important that the physicians as well as the doctors should be aware of hyperkalemia. The first and foremost, whenever there is an ECG changes, check for the potassium. And even if you're not sure, at least give the corrective measures for hyperkalemia by the time your reports reach, rather than pushing in a pacemaker lead. Sometimes it is helpful, but a lot of times it is a very expensive process. And when the patient realizes that this has happened, half the time he goes back abusing you that you could have diagnosed me earlier. So either way, the patient should also know that if they are having problems, cardiology as well as nephrology should be involved, particularly if you know you're having a kidney disease.
Great. So thanks for emphasizing, I think, the multidisciplinary approach as well here, Dr. Ranjan. A great piece of information. Uh, with this, I think we have talked a lot about the disease. Any kind of final remarks for the audience from your end, Dr. Ranjan, around this disease,
Yes,
before
it
we
is very
close?
important because hyperkalemia is preventable, and it should be managed very, very aggressively. Patient education is extremely important. Compliance to dietary restrictions are very, very important, because you must realize that your family is there with you. There are a lot of loved ones around you. So you should not get into a situation because of a stupid act of not being compliant with the dietary precautions from your doctor and your dietitian. So if you have a kidney disease, please follow the orders of your dietitian to avoid getting into a serious crisis.
Great. Thank you. Just in one more message poured in, and they're asking, what all symptoms patients may feel in hyperkalemia,
you
although you have
you
touched
you
upon it.
you may
But
not have any symptoms at all, and those people who are able to pick up the symptoms are very lucky, because if supposing you have, all of a sudden you start feeling that all four limbs are getting weak, you are having difficulty in getting up from a squatting position, you are having difficulty in walking, particularly in a situation where you have an underlying kidney disease, should make you aware. If you are having palpitations, if you feel that every time you get up you have a tendency to fall down, or you are having any situations where you just collapse and then wake up again, so a Stoke Adams, where transient there is a transient loss of consciousness and all. So these are warning symptoms which have to be immediately taken care of. But most important is that you monitor your potassium every month and be under supervision from a nephrologist who has to optimize your medicines and optimize your diet. So as I was saying is that once you are in a situation, minutes are very crucial. Within minutes a person can die. So prevention is the backbone to for the management of this hyperkalemia.
thanks for taking that question. Just one last question, Dr. Ranjan. Uh, what all other illnesses are associated with hyperkalemia? You have touched, but again, if you would like to.
Illnesses is basically if a person, say for example, is having G6PD deficiency, and you have you give anti-malarial, the person can have severe intravascular hemolysis that can produce. So any cause which produces intravascular hemolysis can result in hyperkalemia. Similarly, diabetics with uncontrolled diabetes, who have a tendency to go into ketoacidosis or severe hyperglycemia itself, can cause a shift of potassium from within the cells into the blood circulation. So that is another situation where you crush injury. Supposing you have a roadside accident and your limb gets crushed, so that is another situation where you can have severe hyperkalemia. Then diabetes also, where there is a mild renal failure, not much, but a lot of diabetics are prone to develop type 4 renal tubular acidosis, where the distal tubular function is affected. So these are the people who can also have hyperkalemia. Then, as I have said, Addison's disease is another where the aldosterone levels are low. You can have hyperkalemia. So these are some of the common diseases where the kidney may not be affected. Then there are situations where you may have too much of potassium containing things, particularly things like when you're giving IV potassium to an individual. If it is too much of IV potassium is given, then too you can land up with problems. Or if the IV potassium is given too rapidly, usually we restricted to less than 10 milliequivalents per hour. So this is for the medical people, but the diseases, as I have stated, can also produce hyperkalemia.
Thank you so much, sir. With this, probably we come to the end of the session. I, would like to thank you very much, Dr. Ranjan Isaac, for sharing, your insights and expertise on hyperkalemia. Uh, it's clear that understanding and managing this condition, especially preventing it, is vital for maintaining good health, particularly for those with underlying health issues like kidney disease. And for all of you tuning in today, remember that early detection and proper management can make a significant difference. Always consult your healthcare providers if you have concerns about your potassium levels. And if you're experiencing symptoms like muscle weakness or fatigue, or you're having conditions which put you at risk of hyperkalemia, even if there are no symptoms, regular monitoring is key, as highlighted by Sir already. We hope you found today's session informative and empowering. Don't forget to follow us on our social media page for more health tips and upcoming discussions. Stay informed, stay healthy, and thank you for being a part of Beyond Sugar community. Until next time, take care. And thank you so much, Dr. Ranjan. I think we are really glad you have enlightened us on this very important topic, hyperkalemia. And we would love to have similar sessions going forward as well, with the aim of creating more awareness about
Thank you,
this
Gagan,
around this
and
condition.
wishing you all a very happy new year. With this, I
Yes.
take leave. Thank you so much.